Good morning and hello to everybody. I really like to thank you for inviting myself and Shanta to come down to participate in this health promotion event. It's really fantastic. I really do love that the title, Help Yourself to Better Health. Isn't that fantastic? It's very motivating. Eh? I want to also welcome those who are online. Hello, and thank you for being here as well. So I'm going to tell you a little bit about our team. It's called the Integrated Respiratory Team. We're based at King's College Hospital, South East London. And it comprises of a large team, and we have quite a few services. We have the tobacco dependence service for those sick smokers. Okay. We also have an oxygen service for those who may need oxygen at some point with low oxygen levels on rest. So we do that assessment process at King's. We also have a pulmonary rehabilitation program at King's, and we have about 3 or 4 sites, don't we? We have King's, site at King's, we have Dulwich, Brixton Leisure Centre, and I think we may still have Streatham. Okay, so we can invite you to come along to those sessions. It's very exciting. We also have, we also are actually blessed with a team of psychiatric team and psychologists. So we're all there really, when you come to hospital, which we really don't want you to come into hospital, we have a range of services to support you at the beginning of your journey and to the end. And that's really important, isn't it? You agree?
Yes.
Oh, thank you. I got a little bit of response, thank you. So we really are keen about early diagnosis and evaluation of lung conditions, because if we don't do that earlier, that disease can progress and you become ill, and so that's worse outcomes. We are actually serving in the borough of Lambeth and Southwark, but we also take on referrals outside of that. Okay, and we're actually managing, which I should have said, the speciality of asthma and COPD. Okay, just see wave of hands. Who's got what? Who's got asthma? No. Anybody got COPD? All right, we don't need to say anything about that. We're just going to be here. Anybody who's got a lung condition, it doesn't really matter. This kind of talk will be really quite beneficial because a lot of us are having health challenges. And today, really, what we want to do is to help each other to improve our current situation. Our health challenge may not disappear, but we can do something to improve it. Hence that title, Help Yourself to Better Health. Okay? I'm going to allow Shanta to do the first session with you. That's all right.
Hello, my name's Shanta. I'm one of the respiratory physios from the Integrated Respiratory Team, so I'm based in the community. First of all, can everyone hear me fine? If I'm talking too fast, which I tend to do when I get in the flow of things, or I'm talking too quietly, can you just raise your hand and I'll know that I'm doing that already? Okay, so we're going to start to talk to you about living with breathlessness. And the first slide, we're kind of thinking about what is breathlessness? So breathlessness is a completely subjective symptom. So you can have 2 people with the same type of lung disease or the same heart disease, and they can be completely different. They can find their breathlessness is so different. And it's really appreciating and acknowledging those differences in the experience. It doesn't invalidate it. It doesn't mean that it's not there just because somebody feels a lot worse with it. It's their perception of how things are going and how they're feeling. There are so many different medical conditions which can make you feel breathless. Things from lung disease, that's obviously our speciality, heart disease, liver disease, kidney disease, cancers. Everybody feels breathless at some point or other. You can have perfectly healthy people that are feeling breathless. So if we think about us here in the room, what do we experience when we start to feel breathless? That's my question to you guys. How might you look if you're feeling breathless or you've kind of overstretched yourself and you're doing a bit of exercise? What things might you notice happening?
Get dizzy.
Okay, yeah, you might feel some dizziness.
Face going red.
Yeah, face going red.
Feeling panicky.
Yes, and that's a really big one that we're going to talk about a bit more. So there's lots of different symptoms that come in when you're feeling breathless. And I think you kind of hit the nail on the head there with where we're going to start the talk about the symptom of breathlessness. A lot of these symptoms overlap with that feeling of anxiety. So if I exercise, and when I do, I start to feel really short of breath. If I've got a patient, they tend to start then unwell with their breathing. They might start to feel dizzy, faint, sick, sweaty, and that's just the being unwell. They might feel like their heart's beating really fast and pounding. Now we couple that, all of that falls in the middle, doesn't it? Overlaps with this anxiety. They get shaky limbs, they might feel disconnected from their body, and I think it's really appreciating that those things hugely overlap. So if we go on to the next slide, because I kind of skipped ahead a bit there, got too excited. So when we're thinking about those symptoms of when we're exercising, so we've mentioned that you might, we mentioned some other bits and pieces, but some of the other things you might feel about is we start breathing through our mouth, you take much bigger, deeper breaths. You might find that you're either leaning to kind of recover, putting your hands on your hips, trying to catch your breath again. And we call that fixing your upper limbs, where you're kind of propping yourself open at the top of your chest. Now these, when you're doing them for a short period of time, is completely normal. You're just recovering from feeling breathless. But what can tend to happen over time is you start to develop a pattern of doing that all the time. When I'm doing this, I'm using my neck muscles and the top of my shoulders. Those muscles, they don't really have the stamina to be sat there the whole time, propping and holding up the top part of your rib cage. And they start to get really tired. They're not as efficient as doing that job, and kind of feeds into you starting to feel a bit more breathless. And we're going to come back to that in a little bit, about things that you can try to make that feel a bit better and how we can improve on that. So we've kind of been talking about some of the breathing aspect of things, which feeds into that big cycle of feeling breathless. Now we're going to start to think about the thinking, which you touched on a moment ago when you said you start to feel a bit anxious when you feel a bit breathless. Well, one person could feel a bit anxious when they're breathless. The sensation of being breathless, it's incredibly frightening. Somebody with lung disease described it as feeling like they're constantly drowning when they're feeling breathless. So we've got this frightening aspect of it. They're also not knowing what's coming next. If you're having an episode of feeling really breathless, you start to think, oh, what's happening here? Am I having a heart attack? Am I going to die? I don't want people to see me like this, especially if you're out and about in the community and you start to have an attack with your breathing and feeling breathless. There might be past experiences that are feeding into that. You may have had relatives that have had breathing or heart conditions which make them feel particularly breathless. And you start to think of those memories of them being unwell with their chest. And it all kinds of starts to feed into this, oh, I don't feel really good about this, I'm starting to feel a bit anxious. And like I mentioned before, everybody experiences it very differently. So you can get a perfectly healthy person, like we spoke about before, who feels breathless and kind of feels panicked. Then that can feed in, if you've got lung disease, you've got a very real reason why you're feeling that way as well. And it's difficult to tease apart what's what and what's causing that feeling of breathlessness. Okay. So we've spoken about the anxiety. I came into that a bit too early. So we've kind of covered some bits and pieces about what it's like to feel breathless and some of the thoughts that might go through your head as you're feeling breathless. Then I think this might be, I know most of you don't really have you've mentioned you don't have a lung or heart condition, but when you have a chronic illness, it can really affect your perception of yourself and your relationships and your identity. There's the who I am versus who I was. And when you have chronic illness, these things change, don't they? You're not necessarily the person you were before. You can't do the things that you may have done, and how you see yourself changes over time. And I think there's many different facets to this, which is really important to recognise and to understand. So there could be like the change in the physical appearance. If you're feeling more breathless, you might not be doing as much. It might mean you put on weight. Or it could be that you're breathless and it affects your appetite and you start to lose weight and you don't feel like you look the same. Sometimes it's just the energy that's needed to be able to do things like do your hair the way you'd like to do, or put makeup on like how you'd normally present yourself. And these all kind of then feed into how you identify yourself. Then there's the capabilities of all the different things that you want to do with your time and how you normally spend it. The role you take in your relationships with your family and your friends. And it's trying to recognise how your condition is impacting upon those aspects of your life. really noticing that those gradual little changes of things that you start to avoid doing. So for example, my mother doesn't have a chronic illness, but over time she's finding that her mobility is changing, and she's really starting to notice that impact upon what she's able to do with her grandchildren. And she finds that quite upsetting at times. I can see her getting frustrated with trying to chase after someone who's very little and not really being able to keep up with them. So I think it's trying to acknowledge that those changes are happening and kind of identify them and see what things you can do, because there are a lot of things that, little tweaks that we can do to make things more achievable and feel easier. Oh, and particularly if we think about now, when we're out in public, what with the pandemic, we're all so paranoid about coughing, aren't we? You feel a tickle going in your throat, like, oh my goodness, please don't let me be coughing on the bus right now, everyone will see me and they'll be looking around. So if we think about somebody with lung disease or heart disease, cough and being breathless is such a natural part of your day, and you start to think, oh, I'm dreading going out, I don't want people to see me coughing and be looking at me. So over time, we've kind of discussed those different ways that your perception of yourself has changed. What starts to happen? You might start to avoid activities, which we'll come back to a bit later, but then that starts to have more of an impact on your breathlessness and can make it start to become slowly worse. You might avoid seeing certain people because you don't want to feel showed up for not being able to do the things you'd normally do. It might be for somebody I was seeing yesterday, used to go to the pub every day but to meet friends, and they found themselves getting really embarrassed because when they were there, actually the walk to the bathroom was a real struggle for them. So they just stopped going. And that was their social life. That was how they stayed in touch with the community and who they saw. So you start to slowly become a bit more isolated because of these health problems. And I think, as I said, chronic illness has so many different facets to it in terms of feeling really tired and fatigued particularly, that can play into it as well. So you're having all of these thoughts, all this stress and this anxiety which is feeding into your breathlessness or just into your everyday life. And what happens? How do we deal with this? You might come across me and Chris and we start to talk to you about cutting down on smoking and watching your weight, which can feel at that point a bit impossible. But I think it's really being mindful of that. When we talk about smoking and weight management, these have a huge impact on your breathlessness. So for people with heart and lung disease, the impact of smoking is massive. So we need to start to think about how we can look at cutting back and making achievable changes to try and either cut down or stop smoking. It's an addiction, so you need to be sure that you're getting the adequate support with it. You wouldn't expect an alcoholic person to suddenly go cold turkey and be fine. So why is smoking any different? And that's why we try to help support you with using nicotine replacement products. So you address the actual nicotine side of things. The next thing we need to think about is the habits that come around with it. One of my colleagues, Aaron, who's from the tobacco dependence team, he's a real advocate for thinking about every time you take to smoke a cigarette, you're actually taking time out, aren't you? You'd walk off, take a few moments, be disengaged from all the stressful stimulus around you. You take those few minutes to yourself to recenter, to think about something else. Now we think that, oh, that's the cigarette that's giving me all that stress relief. But actually, how many non-smokers can say that repeatedly throughout the day? You sit there and take a couple of minutes to yourself, away from everybody, go outside and just switch off. And I think that's a really powerful thing to think about, when we think about quitting smoking, is making sure that we take that time for ourselves to kind of de-stress. So we've spoken a lot about some of the aspects of kind of being holistic and thinking about how your life can impact on your chronic disease and breathlessness. And so now we're going to have a little bit of a think about strategies to manage feeling breathless. Which, as I said, I know a lot of you don't have lung disease, but actually a lot of them are quite calming anyway, so it might be, for you think about them as being like a mindfulness activity or something to kind of relax. So, we're going to start off with some what we call diaphragmatic breathing, which is a kind of a fancy way of saying to breathe down into your belly. So I need to be careful of the mic because don't make lots of muffling noises. But what I'd usually advise everyone to do is pop their hands on their chest and on their stomach. So if you all have a go for me now, if you've got a free hand. And so what I want you to do is to gently breathe in through your nose. So 2, 3, and out. Now, get into a rhythm of breathing in for 3. 1, 2, 3, out, 2, 3. Timing doesn't matter so much at this point, just get comfortable with that flow. Now, as you're doing it, I want you to think about keeping your shoulders nice and relaxed and breathing into your stomach. So the idea is you want to fill up with air down in here, because this is usually the least affected part of your lungs with lung disease. It's also, for people who don't have lung disease, the bit that has the most blood in it. So you're going to breathe in deep down to your belly and out, 2, 3. And what I like to do when I'm teaching this is to think about a wave coming in. So the waves come in into the beach for 2, 3, and then the water just subsides away off the beach, and thinking about that noise. 2, 3, and out. Okay, so when we do that, you know how earlier I mentioned to you about fixing your upper limbs when you're feeling breathless? Because we're relaxing our shoulders, you've kind of stopped doing that. You've stopped fixing, you're letting these muscles relax off. As I said, you're breathing down to the pit of your belly, so you're using the better parts of your lungs to breathe. So that addresses that kind of thing. And it's something you can do to kind of take control of your breathing for a moment. The idea is that when you practice these things regularly, that if you're unwell with your breathing, or in a bit of a crisis mode if you're having a wheezy attack, that trying to implement that time can just calm things down a bit, bring some attention to it, and slow things down. There's other things you can use to try and get on top of your breathing when you're having a breathlessness attack. Some people like to use breathing in a rectangle. I've got a perfect rectangle next to me, haven't I? So the idea would be is that you follow the outline of the rectangle in the room. So it might be a picture frame at home for you. So as you go along the short edge, you think about your breathing in. So you breathe in and follow it. Then as you breathe out, you follow the long edge. And as you kind of get on top of your breathing, the idea is that you slow everything down. When you've got lung disease, especially COPD or asthma, and you've got some obstruction, you want to be breathing out for longer than you're breathing in. And with any of these things, as you start trying them, and particularly if you're breathless, it's going to take a lot of practice. They're good to practice when you're feeling well, so that you can implement them when you're not feeling so well. So we've spoken about breathing in a rectangle. Another one that, you've just seen me doing it a minute ago, I really like is counting your breath. So if you're feeling particularly breathless, or even for if you have anxiety attacks, sit there and take note of your breathing and start to count for when you're breathing in. So it might be that you can't even count to 1, you're just that quick. Slowly bring attention to try and bring 1, then build up to 2. Stretch it to 3, to 4, and see what's natural for you to try and do nice long deep breaths. And it's that counting that breath can take some of the attention onto the number and take it away from those feelings of panic and anxiety which can come along with feeling breathless. Another thing we'll go through is a distraction technique using the 5 senses. Now, I have to be honest, I used this one for actually when I was in labour, and I found it really useful, so mine's really vivid. The idea with these distraction techniques, and when it's a visualization exercise, is that you practice it beforehand so that it feels really real to you and vivid. So that when you're in a moment when you're struggling with your breathing, or with any kind of, maybe it might be pain for some of you, that you can pull on that memory of that visualization. So for mine is walking through, you start off on a busy road, because that's when I'm feeling stressed. You turn off the busy road and I go into a courtyard which leads onto a garden. And that garden has a water feature in it there. I can hear the water trickling down. I can hear that breeze. I can feel the sunshine on my skin. I can smell jasmine, because I love the smell of jasmine. I can smell that really pungently, and I think about all of those different sensations that are going on. My toes in the grass. So for you, you might hate a courtyard garden. So you think about a special place. It might be real, it might not be. And really think about that place, and try and think of all the different senses what are going on. And the more you practice it, the easier it is to then implement, as I said, when you're not feeling well. And that's the idea in terms of, as we said, because there's such a huge overlap with the breathlessness and anxiety, is to try and bring attention to something else to kind of help that feeling of calming it down. Another thing you can try for breathlessness, and this is more actually focused with people specifically with lung disease, is fan therapy. So this part of our face has lots of receptors on the skin. And when there's a breeze going on them, it calms down the brain's feeling of being breathless. So you know the little travel fans you get with the 3 blades? So you can just pop that on, direct it at your face, and that can stimulate your brain to think, oh, actually, I'm not feeling as breathless. And it just calms down the sensation of it. Other things you can try is with a wet flannel, it's dabbing down in your face, and that cooling of the water has a similar effect. So it's just over this part of your face. And then finally, this again is a bit more disease specific for people with asthma and COPD, is pursing their lips when you're breathing out. So because of the damage done to the lungs, it's a bit hard for you to get air out and it can get trapped. So when you purse our lips and breathe out, it gives a tiny bit of back pressure, which just means you can empty your lungs more fully. And then you can get more fresh air in, and that can help with that feeling of being breathless. I think, if you mind moving to the next slide. So we're going to come on to think a bit more about functioning and thinking about activity. So what tends to happen, and this, I'm talking about this in the context of breathlessness, but this happens to other people with different conditions. So sometimes pain can feed in with this if you've got arthritic pain. So what starts off with is you become fearful of an activity that makes you breathless. So like we discussed earlier, it might be walking along to the shops. It might be climbing stairs. Because you're fearful of it, you avoid it. And then you start to do less activity. So over time, you're doing a bit less, a bit less, a bit less. And when you look at the whole day, there'll be lots of tiny little things you might be avoiding, but actually the sum of them is quite great. Then slowly over time, your muscles, they start to become weaker because they're not being exercised like they used to be. These weak muscles, they actually start to need more oxygen because they're not working as efficiently as they did. You start to feel more breathless, so you do less. Your body can't then cope with the stress of it, and it just spirals. This is something that's modifiable. So if we go on to the next one. One of the most important things for people with lung and heart problems is exercise. Like I said, that's completely modifiable. We just need to identify what it is you're struggling with and kind of make accommodations, and also need to exercise regularly to be able to build up our strength. So this is a positive cycle of activity. So you keep doing your activity, or you do more. So we should all be exercising, I think it's 150 minutes or 75 minutes of being really vigorous. But the idea is that separate exercise. So it's good to be generally active, but it's about keep raising your heart rate and sustaining it for a period of time. So it's really important to be mindful of that, because quite often people will be like, oh, well, I do my gardening and I put around doing this and that. And it's not taking away that there's not an activity that exerts you, but it's not the same as doing focused exercise where you're strengthening up all specific muscles and having your heart rate high for a sustained period of time. So we engage in this exercise, and it starts to mean our muscles become stronger, they become more efficient, and then over time you start to feel less breathless, and it becomes easier and you feel better. And this applies to any of us. If I don't go for a run for a while, which I haven't, so the next time I go, it's going to feel like a horrible slog. I'm probably going to hate it. But the time after that, it will be that bit easier, and the time after that, more easier. And you build that exercise tolerance. And that's the same with people with lung disease and heart disease. We can gradually build on that and make you able to do more before you get more breathless. Now, I've mentioned it as terms of exercise. Ideally, everyone would be generally active and doing exercise, but it might come to a point with your disease that actually it feels like a bit too much of a challenge, or you just don't feel comfortable with it, you're not sure how to go about it, and doesn't feel like a realistic goal for you. And that's where you might come to see us in pulmonary rehab. So pulmonary rehab is an exercise class for people with lung problems. There's also cardiac rehab as well for people with heart problems. So the idea of that is that you come to see, we're there in the gym, or it might be for some places they have it based in hospitals as well for people who really struggle with their breathing. That you come see us, we help you to exercise, and we gradually build you up. We're not expecting you to turn up and be running on a treadmill. It's all aimed at where you are at that point in time. So we agree a plan with you, and over a course of, I think it's a couple of months, 6 to 8 weeks, we gradually build you up so that you're able to do a bit more, and feel confident and comfortable doing this. because that's, for anyone, it can be really daunting starting off a new program of exercise. And then gradually over time, then we'd hope that would impact, well, not gradually over time, it does impact on your lifestyle. You'll notice big changes of what you're able to do and not able to do, not able to do, what you're able to do from having done that exercise. Okay, now I think Chris is going to continue talking about that functioning side of things and how we can enable you to do a bit more.
Thank you, Shanta. Hello, everybody. Can we kind of like move about a bit? Have a little bit of movement? Thank you for that wonderful presentation. Let me just get out that light. Thank you for the presentation, Shanta. Yeah, if we don't use it, we'll lose it. Is that right?
Yes.
If we don't flex that muscle will deteriorate. And so as we discussed about this inactivity because of breathlessness, we're going to look at some strategies that will help us, to do a little bit more. We want to get a little control of what's happening to us, don't we? Don't you think?
Yes.
Yeah. We can't have a condition taking over us. I mean, so we want to try and implement things that we can have a level of a little control. Some of us won't have that capacity anymore because we're so severely ill, but we have a mind and we should be able to choose and make decisions for ourselves, even if it's in smaller matters. Even if you make one small change today from the techniques, I keep going into that light, you make one small change and it's consistent, you will see the difference, believe me, you will see the difference, and that might give you a lot more confidence to do more, to do something else, add something else to your program. So what I'm going to talk about is a little bit about fatigue and weakness, which comes into that cycle of inactivity where your muscles fail you, you get more bad days than good days.
Yeah.
Yeah? And so we're going to talk a little bit about that. What we need to do in terms of that, you've got to know what is it that you like doing. Yeah? You have to identify an area that you like, or a task or activity that you really want to do. It's very important to you. Once you recognize that, that's good. You say, that's very important, I want to do that. Whether it's, maybe it might be having a shower every 2 days and you find that difficult. So you'll say, that's important for me to do that and I want to do that on my own. So you have to make a plan for that. Then you have to look at tasks that you want to do but you find difficult to do. Does that make sense? Good. So you would have to then consider, how can I make that task easier? What do I have to do? Do I have to do small bits and build up? Because sometimes in our minds we think, yeah, I can run here, I can do this and I can do that. But your mind's saying this and your body's saying, no, hold on, stop here. You can only do this bit at a time. So sometimes we want to do things really quickly, but our body's not able to manage that. Is that all right? So we have to make a plan. So once we've organised the plan, say example, you might be able to get a family member to help you out. Yeah? Say example, so just give you some examples here. Washing and dressing. I don't know if anybody's got difficulty in washing and dressing. That might be a problem for some people. So how would you plan your day to get yourself, to attend to your personal hygiene needs? You may have to perhaps get all your clothing and put it to one side on the bed a couple of days before, or if you've got a hospital appointment and you know that the ambulance crew is going to come 2 hours' time, maybe over a period of a few days, you would be putting things down to one corner. You may pack your bag, you may do whatever, put things to one side. Then you would probably have all your toweling, you'd probably purchase a toweling dressing gown. That would be quite useful, because if you get wet in a shower and you go into a shower, you can, when you come out, you can put your toweling dressing gown on you and sit down and that will dry itself. Does that make sense? You don't have to move around and rub yourself. So we said about laying out toiletries. In terms of in your shower room, when you go in your shower room, it might be quite hot. So maybe you might, if you're on your own, you might want to leave your door open. You might have a little bit of the window open a little. So, because sometimes it can be quite smothering in a warm shower. You use warm water, not hot. so you're not affected by the steam and heat. Make sure you have some grab rails if you need that in your house, or you may have a perching chair. Okay, that's some ideas what we can do. If you have difficulty, you can have zip-up garments. You can get help from the occupational therapist, yeah? They can for aids and adaptations for your home. So that's some techniques. Talked about washing and dressing. Let's talk about a little bit of food, because I know we've got kind of like a short time. And remember, when all these activities, what we want to achieve, we can do that bit by bit. We have to prioritize them, we have to plan it, you have to do pacing. Pace yourself so you don't get over-exhausted. You might wake up one morning and feel really great. I can get this done, get that done, and then for the whole week you're flat. So you don't really want that. So we try and do a bit of activity, bits and pieces, and you know, a bit every day is better than nothing. Do you agree? No? Does anybody agree with me out there? I feel like I'm on my own. Okay, all right, cool, and that's really wonderful, thank you. We're going to quickly go on to nutrition while we're talking about food. It's very important with people with lung condition to eat well, and we often have the problem. So the importance of nutrition is why, one, to build up your immune system. You know, we've got lots of viruses all over the place now, yeah? So we have to eat, you have to eat food like medicine. It's an art, a science. And many people with lung conditions are unable to eat. They have lost their taste for food. They have no appetite anymore, yeah? And that's for different reasons. And by eating well, by having a variety of food of choice, we can reduce the risk of infections and we can recover quickly, okay? That's really important food. Individuals with lung disease often experience shortness of breath, which is a problem, and they may use up to 10 times the calories of a healthy individual trying to catch their breath. See how important that is? You can walk 5 steps here, but for somebody with lung disease, I can walk there, it'd be like running a marathon. Breathing, which is normal for us, is difficult for somebody else. So what we don't want is malnutrition. You know, you can become not eating well, the right foods, you lose weight, then your respiratory muscles get weak, you're not able to expand them very well, your walking ability decreases because you just feel fatigued. That's why Shanta was talking about pulmonary rehabilitation. It's a lifesaver, because when you're, come on, physio. Quadriceps gets weak, you're in trouble. Especially when you spent some time in hospital, you know, and they have you in bed for 4 or 5 days, you're in trouble. We're going to have to keep moving, yeah. Otherwise, you lose that ability to walk the distance. So hopefully you don't go into hospital. If you ever do go into hospital, we need to try and rehabilitate quite quickly by getting out of bed and try and do as much as we can. So we talked about malnutrition. Obesity could be a problem, and still being malnourished, because maybe they might be on long-term steroids, okay? And so that can make you put on some weight. So we need to look at some reductions. And also people who've got sedentary lifestyles, people are housebound, you know, they're obviously going to be a bit obese, and so that's going to impact their life. So weight loss, I think we will probably need to seek your dietitian to have some input from them. And we have to be wary about osteoporosis. Could you tell me what 5 food groups could you name that we need? Come on. Come on, I'm getting you. Sorry? Yes, carbohydrates, is that?
Yep.
Protein? Yeah? Fats? Pulses?
Yeah.
Yes, perfect, brilliant. So we need the protein. Why? Sure. To build in, yes, keep your muscles. That's what we want to do. And that's why we go to pulmonary rehab. So we can learn to build those muscles, carry those bags, and walk a little bit of a distance. And then we got carbohydrates. And why do we need that? We need that for, thank you. Well, I've got some nutritionists in the background here. Thank you so much. You're making my job much easier today. And yes, vitamin and minerals, especially what type of fruits and vegetables do we need? That's right. So we've got this. Hopefully you can download this thing. Yeah, it's the Eat Well Guide. Yeah, it's absolutely fantastic. Okay, it's got loads of vegetables on the way. Loads of vegetables on one side, and you've got your bananas, your vegetables. That's to help to build the immune system. Come on, we've got to remember, nowadays there's a lot of respiratory infections. You've got to build your body up by eating proper food if you can. And a lot of us have to get frozen food. Maybe you have to get frozen vegetables. You can have tin fruits as well. You may have to shop online because there's lots of barriers to eating nowadays, isn't it? There's lots of barriers, and you may have to get help. You may have to get a family member to cook food for you over a few days, and you can freeze it and add a few. So we have to think and be a little bit creative with that. Or you can get your food delivered online. Those are some of the things that we can think about. And say, these are carbohydrates. So we've got the pastas, the bread, the rices. Yeah? You like your pastas? Pasta tuna, whatever? Yeah? Cool. Yeah, so that's for what? Yeah, energy. Okay? So we've got all these important foods. What are some of the problems that we get with eating? What is it? So we mentioned some of the barriers. What are some of the problems we get with eating? Pardon? Ah, thank you so much. Oral, important oral care. Okay, you know with your inhaled steroids, you're prone to get a fungal infection if you're not rinsing your mouth after. If you've got ulcers and so forth, that means you're probably run down, you're not getting all your vitamin and minerals in. You remember your mucosa line in your mouth becomes dry, you're going to get sore lips, sore mouth, and run down. So you need to drink. I believe in washing your mouth with salt and water. Yeah, get rid of all that horrible mucky down there. Make sure you clean yourself properly if you can. Yeah, so that's important. And get your mouth sorted. So we talked about that, clean dentures. And in terms of if you've got poor or, it's very sore, we can probably look at softer diets with more sauces, try and cook a little bit more casseroles. You wake up in the morning, you've got just throw a thing in the pot, do some stews, do you know what I mean? With protein and everything else. Anybody got any recipes to share?
And I think that's particularly important, isn't it, with the dry mouth aspect of things.
Thank you.
And if you're breathless when you're trying to eat, and it takes you longer to chew on things, if you've got something soft and saucy, it's quicker not quicker, but it's easier for you to have it ready to swallow. So if you're breathless as you're eating, it's an easier thing for you to manage to eat.
Thank you so much. Yeah, so you get your cheeses, softer diets. Yes.
Yeah.
And you know what? You can do a smoothie as well. Some of us don't like those nuts and stuff. Sometimes they're a bit hard to digest. You can actually put them in a little bit of water overnight, or you can put them in a smoothie. There's lots of good things you can do, and these little things that you practice every so often, you will actually feel the difference. All right. So we talked about coping with a dry mouth.
I think we've just got a couple of minutes left now, Chris.
Have I? Oh,
yeah.
That's sad. What about a couple of minutes? How is everybody sleeping? I'd say, yeah, it's always a problem, sleep, isn't it? Sleep. So we're going to go a couple of minutes. Forget about the Coke and the caffeine. If you're going to have your caffeine, have it in the day, and not such a strong one, all right? Because that it keeps you awake at night. Coke is not the best food to have. It's got too much sugar in it, okay? Too much sugar, and it's not going to. You don't feel well when you have a lot of sugar in your body. In fact, you're more prone to have more disease if you eat sugar. So we must stay away from a lot of those horrible drinks and stuff. So at night time, what we do, have a darker room probably, yeah? Have a calm, a nice herbal tea. Will that interest anybody, herbal? Okay, that's good. Anything else? Anybody else can suggest anything that they do, a hot drink? What do they do to get to sleep at night?
Ovaltine.
Oh, Ovaltine, yes.
Just plain water.
Plain water, and it's good. So you must drink in the day and actually get your water intake in as well. All right? about 8 cups a day, so that you're not weaning at night. So just, yeah, so, and that's nice calming music. Thank you. I've been told to stop. Thank you so much for your participation. It's time for